you, Ivan, for chatting with me today. Can you just tell me a little bit about you're using story image therapy and tools with Indigenous clients?
Yeah.
Can you tell me a little bit about how you use them?
Yeah, so the tools that I use, obviously the stories. A lot of these stories that we use with our families are obviously to help them understand, how they're reacting or how they're dealing with things that are put towards them, whether it be from family, Department of Child Safety, or the children in themselves.
Yes.
Helping them to understand, sometimes how they deal and cope with these things that, life in general will put to anybody and everybody. If they don't have the tools and the reasoning to be able to cope with these things, hence the outcomes are usually, which is where our service comes in, are usually aren't the preferred kind of or desired outcomes. So they're either using substances or aggression, or they're using other areas that become, obviously a risk to the child's safety or well-being.
Yes.
So in our line of work, it's being able to help families identify what not only the concerns are from child safety or education or health, but to understand why they're coming about, and then using these tools to be able to help them make that change, identify within themselves, what's happening to their bodies, what's happening in their minds as they're dealing with these things as they arise, and then being able just to change the direction of normally a normal behaviour would be I would yell or scream or get angry or I can't cope, so I'll stress out and then I'll either sleep or I'll use substances. The outcomes of that then is, okay, well, what's happening to the children at these times, So it's being able to have them or help them with these tools to be able to think the process through, to be able to apply those strategies and use these tools to be able to see, not only hear. Like a lot of families, they hear the concerns from child safety, there was domestic violence, there was neglect, there was this. But to be able to see the concerns, and not just the outcome of what it was, domestic violence, but see how it came about. How it escalated to that point. How did neglect escalate? How did all these things happen? So now child safety are involved. And so
how have the stories helped you to actually help them to see the progression of where they've come to?
Well, I think the stories kind of helps them personalise. Understand how they get triggered or how they get trapped emotionally into a certain outcome, whatever it might be. Every family is different. And everyone handles trauma and grief differently. But when you think about human behaviour, we all kind of react in similar ways. And to, especially with the frog and the scorpion, help them to understand just first of all human behaviour. So when these things happen, obviously if you're so concerned, and everyone's concerned about a lot of things in their lives, whether it's work, whether it's children, whether it's education, or relationships. When things aren't going well, people react to it in a way, obviously so it starts off as a learnt behaviour from maybe when they were children and how their family were reacted with them. But they carry those things through and develop belief systems that then subconsciously comes out in the way that they parent or the way they're in a relationship and so forth like that, or how they cope. So with these stories, then it helps them to be able to connect, their outcomes or how they're behaving, but what's happening with their body. And once they can see what's happening to themselves and see where they're at. Obviously with the frog and scorpion is a brilliant one to understand, when they care so much, and who wouldn't care about their children? Especially when child safety is involved in threatening to take their children. Obviously they care a lot, but then sometimes they can trick themselves or hijack themselves instead of working with the department to say, okay, I understand what's happening, I need to make some personal changes. They get hijacked, they emotionally become upset, which they don't know how to cope with it because someone's coming in to take my kids. They become angry, and so then they'll be quite aggressive to the department, or they'll be reluctant to work with services, and
so they might act like an AWOL scorpion.
Most definitely, yes. So I think that's one of the great things for the stories, especially with the adults, the frogs and the scorpions, is that it helps them to see what they're doing. When the child safety gets involved, or when whatever the scenario is. What are the things that you do? I get angry, or I start to, resent people, or I'll start to become aggressive, verbal, and then we start to identify, well, all these behaviours are because you care so much. And it's good to care a lot, especially if your children are concerned, but it gives you nowhere to go.
Okay, so do you use that story to teach them about the balance of 80?
Yeah, I do. And I think once they kind of connect their behaviours and where it sits, and they understand why it is they're behaving like that, then they start to see that, they do need to kind of pull back a bit. And it can be easy for us to say, you just need to care a little bit less, getting back to that balance of 80, because that will allow you room to be able to, move in and out between, whether it's somebody coming into your face with a knife, or, whether it's, it gives you somewhere to go. So with them, it enables them to kind of analyse themselves and go, okay, I need to maybe change the way I'm behaving. But that's all good to say, but how do you do that?
That's right.
And that's where it changes.
Yeah, very good. Do you use other stories as well, like besides the frog and the scorpion, if you're trying to explain their behaviour to themselves, do you use other stories as well?
I tend to use the frog and the scorpion the most. I've used that one because that's one of the key areas, especially with my clients. I mean, if I had another client that came up with a different situation, I would definitely use some of the other ones as well. But usually I do stick to the frogs and the scorpions, but I'll introduce the other tools that come with that, such as ones, escaping a tornado, or the scales of stresses, ways of coping. Because it's good to have them to see, the behaviours that they're allowing themselves to get into. They can see that they need to pull back. But how do you do that when I've been so used to this is normal behaviour most of my life? It's easy to say I want to change, but it's how do I do that and have support to do that? And that's where those tools come in so useful, because it can help them draw out what's in their mind, to put it onto some paper, and then with the imagery that comes with these tools also, which is a great thing, it allows them to see and understand, say for example the tornado. Yes, the tornado can be very destructive down the bottom. What's dragging you down here? You identify them for me. What are those things that, from the least to the most strenuous, and the things that give you most anxiety? And then we'll correlate, some of the times it's hard to get out. You really need support or intervention when you're down in this area, when you cross that line. So what are some of the things that you could think of that would help you? Sometimes it is medication. Even though they might not like to take medication, sometimes you need to do that just to kind of help you to get to a little bit a better place, to be able to then, now that you're kind of calm and a good place, implement these things, or have that support, engage with services or a counsellor to help you to just get to the next level, where you can then, manage it on yourself, and then we'll identify what are those things, family, friends, cutting back on substances, seeing a counsellor. So those kind of things are useful, because otherwise people or families we work with don't usually have the time. Well, they do, but they don't have the maturity to be able to pull themselves out of the predicament that they're in, the hole they're in. It's okay for them to say, yes, I want something different, but they don't have the ability or the knowledge to make any changes. So these tools it's good in the sense that it gives them a leverage to be able to make those changes by identifying, well, this is what I need to do step by step. No, I don't really cope so well. So when this thing happens, how do you normally cope? Well, I used to do this. What could you do? You're allowing them to use their own brain and their own reasoning to draw out better solutions.
Do you find that the story image therapy tools are more effective than other tools that you've used in the past with Indigenous clients?
I've found that it's worked a lot better, because, and this isn't just, it's applicable to all cultures, not just in Aboriginal, but it allows them to be able to visualise a situation, and having an illustration or something where they could portray their own selves and not personalise it, but put it into something that was, how can you say, more comforting for them to be able to not so much disown, but to manage, so that way they're not taking full ownership of it. It allows them to be able to open up. They will literally come out and tell you things where normally, if you ask them about a certain thing, it's like, oh, it's okay. That's all good. Things have been good. Things haven't been too bad. It kind of allows them to put what they're feeling inside and to put it towards, a tornado or a scale or a fish. Or, it does. It helps, which means then I can be able to get information from them that I normally wouldn't get. And then I can put those things together and help them see that. So when you say these things, can you see how normally you would get before? You used to get like emotionally hijacked and you used to get cranky, and that would, escalate you into a problem. Now that we've identified these things, can you see the benefits of maybe trying things differently? That makes sense. They get that little light bulb moment where they click and finally, not just hear, but they can see it for themselves. And that's the most important thing, is getting a bit like alcoholics, you know, you can't change them unless they start to identify that they have a problem.
That's right.
And sometimes for a lot of our families, there's a lot of problems there that they don't see because it's not a problem, because it's what's normal their whole life. But when we try to put things into perspective, well, look, it's about the safety of your children and the well-being of your children. You know, you need to kind of make change to break that cycle. We don't want our kids going to care.
Help you to do that.
Oh, most definitely.
Most definitely. Okay. Wonderful. So really, this is an effective method that you have been using, and you think it is perhaps more effective than other therapies or other methods that you have used, particularly with Indigenous clients or clients in general?
Yeah, well, all the clients that we work with, obviously they're Indigenous, but sometimes we'll have families whose children are Indigenous, but father might have been Indigenous, but mum's not Indigenous, but she has care of the children, so we'll work with her. And the principles apply to her, as we mentioned before, like it transcends culture, really. But I've even found that, you know, with the Indigenous families that we work with, the parents, because a lot of Indigenous families are very ashamed to talk about their problems, you know. This kind of helps them feel comfortable to express, you know, certain things and to put it onto an image rather than take ownership of it, you know. And sometimes that's just allowing them to do that is therapeutic in itself. Someone to talk to about something, you know, so I found it very helpful.
Wonderful. That's wonderful. I'm really pleased. Thank you, Ira, for that. That's great.
Thank you.
Thank you.